Hi, my name's Brett, and this is the Backpacking Channel. Thanks for tuning in to this video. In this video, I'll be covering a few things about first aid and things you should just know just in case you ever get into an accident on your backpacking trip. One of the first steps in first aid is reducing risk. The best way to stay safe and healthy, both at home and outdoors, is to understand the risks involved in everything you do in life. You need to be aware of the risks and adjust your behavior to be able to manage said risk. If you understand and are aware of said risks and know how to manage them, you will be able to provide a way better assistance in managing someone else if an emergency ever arises around you. Here's a few tips on how to make sure that you can reduce risk in everything that you enjoy in life. Backpacking trips can be physically demanding, so it's important to stay in good physical shape so that you are ready for the demands of the trek. You should always know where you're going and what to expect. You should also be adjusting clothing layers to match changing conditions. You need to be drinking plenty of water as well. Since you'll be outdoors, you need to protect yourself from exposure to the sun, also biting insects and poisonous plants. And you should be aware of the poisonous plants in your area, as well as the types of insects. Be sure that everyone that is going on the trip with you understands and follows the group guidelines established to minimize risk on your trip. How to handle an emergency. How to handle an emergency, you should first always check the scene. When first coming onto the scene of an accident, it can be very confusing and sometimes shocking. You need to stop and you need to think, what caused the accident? Are there any immediate dangers around me that caused the accident? How many people in your group are hurt? And if there's anybody nearby or any planned route of evacuation that can assist you better. After checking the scene and understanding the situation thoroughly, you need to call for help. If you come in contact with a minor injury or some small illness, just try to get emergency medical help as soon as possible. You can reach emergency services by calling 911, but on a backpacking trip, you can be far away from telephone services. If one of the group members is injured but still can walk, you might be able to hike up to a road. Or if the injury is severe and they can't walk, a stretcher can be made out of 2 pieces of sticks and some of your clothing or a tent tarp. For extreme injuries, especially spinal cord injuries, you don't want to move the injured. You should send 2 people to go get help while the rest wait and tend to the injured. In some cases, you might need to provide urgent treatment. In the case of someone being unconscious or not breathing, you should try tapping the person on the shoulder or shout to see if they're all right. If the person doesn't respond, you need to try opening up their airway. You can do this by tilting their head and lifting up on the chin. Then place your ear near the mouth and nose where you can hear and feel the movement of air. Watch for the chest to rise and fall. If they took a serious fall, you might want to check for some severe bleeding. Taking off their top layers is a good way to check to see if there's any type of severe bleeding going on. By leaving the top layers on, a severe bleed could go unnoticed for an alarming amount of time that could create a more serious injury. In every somewhat severe or even mild accident, you should treat your victim for shock. Shock is a term for when the circulatory system of a person who is injured or under great stress doesn't get enough blood and oxygen to the tissue of the body. This can be deadly and cause organ failure. A shock victim can have restlessness or irritability, a feeling of weakness, confusion, fear, dizziness, skin that's moist or clammy, a quick or a weak pulse, shallow, rapid, or irregular breathing, nausea and vomiting, and extreme thirst. Here's a quick guide to apply first aid to shock patients. Try to eliminate the causes of shock by restoring breathing and circulation, or maybe even controlling bleeding or relieving the severe pain. Step 2 is to get emergency aid. Step 3 is to monitor the victim closely to make sure the airway stays open for breathing. If the victim is not already going to do so, help the injured person lie down. If you don't seem to think there's a back, neck, or head injury or a fracture to the hip, you can raise the feet about 12 inches to move blood from the legs to vital organs. After that, just try to keep the victim warm with blankets, coats, and sleeping bags. Before heading out on a trip, a great way to be prepared is to keep a personal first aid kit. Personal first aid kit should have some Band-Aids, sterile gauze, adhesive tape, some moleskins for whenever you're hiking and you're getting blisters, a bar soap, and some alcohol pads, some sort of antibiotic ointment like Neosporin or a triplet antibiotic, knockoff brand that you can get from like Walgreens or Rite Aid, a small pair of scissors to like cut gauze. I always bring a pair of non-latex disposable gloves with me too, just in case you need them in an emergency. I also bring some pencil and paper just in case we need to write anything down. Thank you for watching this video on first aid. I hope it taught you a few little things that you could use on your backpacking trip. Have fun, stay safe, and enjoy the outdoors.